This is the oral condensed case study for Mr. MS for the DNP Role 1 class. Mr. MS presented with a chief complaint of cough today. He's a 37 HPI, 37-year-old Hispanic male, presents with complaints of coughing, headache, and nasal drainage for 3 days. He started producing dark yellow sputum today and complains of severe headache with coughing. His son had been sick at home and is getting better, but patient states his cough is not getting better, and he has taken Dayquil and codeine, which he borrowed from his cousin, and codeine has helped his cough. He denies any chest pain, shortness of breath, fever, and chills. Number 2, review of systems. General health denies any lack of energy, denies any unexplained weight gain or loss, denies loss of appetite, denies fever, night sweats, pain, in jaws when eating, or prior diagnosis of cancer. ENT, he denies any hearing difficulties. He complains of sinus drainage and runny nose. Denies any ringing in the ears, mouth sores, or nose bleeds, and denies any facial numbness or pain. Cardiovascular, he denies any history of murmurs, irregular heart rates, denies any swelling and pain in legs when walking, and denies chest pain. Respiratory, he denies any shortness of breath, night sweats, prolonged cough, and this cough has been for the last 3 days. Denies wheezing, denies prior tuberculosis, history of asthma, and denies smoking. Allergic immunologic, he has seasonal allergies, but no symptoms prior to this current sickness, and denies any itching or teary eyes. So number 3, physical exam. Vital signs: temperature of 100.9, heart rate of 120 beats per minute, respiratory rate of 16, systolic blood pressure 128, diastolic 82. General health: alert and oriented, no acute distress, well-developed Hispanic male, answers all questions appropriately and maintains eye contact through the interview. HENT, normocephalic, pupils are pearl, extraocular motions are intact, conjunctiva clear and sclera non-icteric, and ears, no hearing deficiencies, tympanic membrane landmarks were well visualized. Nose, left nares is red and boggy with minimal sinus drainage. Right nares is within normal limits. Mouth, no obvious lesions, or oral mucosa is moist. Respiratory, actually neck, supple, non-tender, no lymphadenopathy. Respiratory, lung sounds are clear to auscultation. Respirations are non-labored. Breath sounds are equal. Symmetric chest wall expansion. Cardiovascular, tachycardia, normal perfusion. Cap refills less than 3, no edema. S1, S2. And integumentary, skin's warm, dry, and pink. Complaints of both hand dryness. Neurologic, alert, oriented ×3, normal sensory motor function, no focal deficits. Cranial nerves 2 to 12 are grossly intact. Normal deep tendon reflexes. Number 4, recommended diagnostic test. Rapid point of care rapid flu test was done and was positive for flu A. Number 5, impression and diagnosis, differential diagnosis, confirmed diagnosis of influenza A, differential diagnosis of common cold, viral upper respiratory infection, tonsillitis. Plan is to prescribe a Tamiflu 75 milligram oral capsule, POBID times 5 days, with the common adverse reaction of nausea and vomiting. For Tamiflu, we are going to prescribe Zofran 4 milligram oral tablet, Q6 hours PRN, nausea and vomiting. Fluticasone 50 mics per inhalation nasal spray, 1 spray daily. And patient also instructed about supportive treatment with personal hygiene, hand washing, using mask, and avoiding contact with other child at home. Keeping head of bed elevated at night, getting adequate rest and hydration, using NSAIDs for fever and body ache, honey for cough, and humidifier. It provided education regarding the expected course of this current illness, reviewed contagious nature and how to prevent spread of the disease, safe and appropriate use of OTC meds and worsening signs and symptoms, and when to seek emergent care. Plan is to return to clinic 1 to 2 weeks, if not better, or sooner, if the symptoms persist or worsen, especially fever. That's it. Thank you.